Hello everyone, welcome to my research talk. Are you a clinical dental practitioner or public health researcher and want to assess how much oral health related quality of life you can improve to your patients through your dental treatment or through your dental intervention? Then this video is for you. In today's talk, I am going to discuss measuring oral health related quality of life in children. I am Masuma Parveen Mishu. I am a public health researcher and lecturer based at University College London. Today I am going to discuss the paper titled Cross-Cultural Adaptation and Psychometric Properties of the Bengali version of the Scale of Oral Health Outcomes for 5-year-old Children, in short SOHO 5. So this SOHO 5 is a scale to measure oral health related quality of life in 5-year-old children. I published this paper from my PhD thesis. This is the second published paper, and I published it in Health and Quality of Life Outcome Journal. The reason I'm going to share this paper today because this Bengali translated and cross-culturally adapted questionnaire is available through the appendix of this paper online supplementary file I attached as the Bengali version of the questionnaire, both the child version and the parental version. So if you are interested, you can freely download it and use it for your clinical practice or dental research. Hope you will find it helpful. So let's take a look at a little bit at the methods that I followed for this cross-cultural adaptation and psychometric properties testing for this questionnaire. So here I mentioned that oral health related quality of life in Bangladesh has not been measured, as there is no validated oral health related quality of life measure for this population. I'm talking here the year 2015, where I conducted my pilot study in January, and then July, August, that time I conducted the main study. And at that time in 2014, when I was doing the literature reviewing and finalizing the preparation of my dental survey for my doctoral research, I couldn't find any translated validated questionnaire. So I needed to select the scale and then do the translation and do the cross-cultural adaptation and test the psychometric properties. So after consulting with my PhD supervisors, I selected this SOHO 5 scale, which is quite a short scale, which is appropriate for this kind of population level survey in children. And this SOHO 5 scale is comparatively easier to use, not only in the survey but also for the data analysis. So I selected this scale, and as you know, I shared my research question, PhD research question, in another video. Just to remind you, it was on testing the association of dental caries and anthropometric measures, that's height, weight, and BMI in 5 to 9-year-old children in Dhaka, Bangladesh. And as my research hypothesis, I tested that these untreated dental caries, it can have negative impact on their oral health related quality of life, which can in turn ultimately impact their growth. But as I conducted a cross-sectional study, I can't measure their growth, but I measured their height, weight, and BMI, these anthropometric measures, as a proxy measure for child's growth. So definitely I needed to measure this oral health related quality of life, and I used this SOHO 5 scale. So what I did, I first did the forward-backward translation of this scale, of the SOHO 5 scale, and the SOHO 5 scale, as it was developed in the UK, so I just can't translate it and take it to Bangladesh. I also needed to do the cross-cultural adaptation process. So I first piloted it among the translated version. I piloted it among 272 children and parents to test the face validity. And then the questionnaire was finally administered to 788 children and their parents to evaluate its psychometric properties. And I followed the process, the standard process to evaluate the psychometric properties. I tested the internal consistency of this Bengali translated questionnaire using Cronbach alpha, tested the retest reliability, assessing the kappa score, and convergent and discriminant validity. I used it through the non-parametric test. And in the result, just briefly to show you, both the child report and the parental proxy report questionnaire showed good face validity, and the Cronbach alpha score and the weighted kappa score, all these showed the good internal consistency and good retest reliability of this questionnaire. And this questionnaire were also significantly associated with subjective oral health outcome and discriminated clearly between different caries severity and sepsis group, which means that the children with higher level of dental caries or dental sepsis, they tend to have poorer oral health related quality of life. And after adjusting for different confounding factors, for example, child age, sex, setting, maternal education, family income, these odds of reporting poor oral impact was still statistically significant. So overall, in conclusion, I can say that this study provided strong evidence supporting the validity and reliability of both parental and child version of this Bengali translated SOHO 5 questionnaire, and hopefully this SOHO 5 questionnaire Bengali version is expected to be useful as an outcome measure or as a resource for any clinical dental research, not only in Bangladesh but also Bengali speaking child population across the world. So that was the main aim of sharing this paper. I will show you in a moment how this questionnaire look like. If you are interested to use it, you can download this Bengali translated questionnaire and use it in your clinical dental practice or in dental research. Just 1 minute to show you that questionnaire. So this is the questionnaire, Bengali translated version. This is the child version. So there are 7 questions, and you see here this is the answer card. So there are some smiley face, sad face, neutral face, which facilitates the children to answer the question. And this is the parental version of the SOHO 5 questionnaire. And if I quickly take you to the results of my study, I can show you how the scale was. The different score of the scale was distributed in the population. So in the SOHO 5 item, we have the score for eating difficulty, difficulty in drinking, speaking, playing, avoid smiling due to dental pain, avoid smiling due to appearance, difficulty in sleeping, and self-confidence, whether their self-confidence was affected or not. For dental pain, we had 2 questions, one on ever dental pain and current dental pain. And these are the scores for Cronbach alpha for the child version and the parental version. And this table showed the association of subjective and clinical indicators of oral health with this SOHO 5 scale, as I was explaining before. And this child SOHO 5 questionnaire parental reported one was also subjective, associated with subjective and clinical indicator of oral health. As you see here, the children with higher level of dental caries and dental sepsis, I used here the POFA, that's pulpal involvement, ulceration, fistula, and abscess, that score to show severe involvement of dental caries if it goes up to the dental pulp and causes further consequences. These children tend to show poorer oral health related quality of life. compared to those who didn't have any pulpal involvement, ulceration or abscess. And similar, this was the case. Children without dental caries, they tend to have higher better oral health related quality of life compared to those who had more. Like, I categorize this caries score as decade missing filled teeth 3 to 5 or more than 5. They tend to have poorer oral health related quality of life. And again, this is the same kind of testing, but I used it with the regression analysis and both the logistic regression model that I used here, and showed that even after adjusting for the confounding factors, there is still association of dental caries and sepsis with oral health related quality of life. So finally, I concluded that the dental caries in children, this has negative impact on overall oral health related quality of life in children. So these need to be highlighted in clinical dental practice as well as clinical dental research, and these scales could be used in the Bengali population. And as we know, for any kind of dental intervention, we need to generate the evidence so that we can show it to the funder or the other organizations that yes, there is a need here, so that it will get more emphasis in clinical dental research and practice, and further intervention hopefully will come to improve this dental health condition in the children. Especially, I'm talking here the study population in Bangladesh in my PhD, as my PhD was conducted in this population. So hopefully you will be able to use this oral health related quality of life Soho 5 Bengali translated questionnaire, and if you face any difficulty, please let me know. Hope that you will find this scale helpful. Hope to see you in next video. Thank you. Bye.